I'm Piet Boshoff, maxillofacial surgeon, and I've gone through the whole gambit of conventional medicine and dentistry, and I've realized, unfortunately, only over the last 10-12 years, how limited we are by conventional medicine and dentistry. We're very much limited by our fear of what our colleagues and what our patients are going to think. And I've touched on things, and I'm going to touch on things today that are going to make me sound like a sangoma. As I say, I'm going to possibly demonstrate things on you today that look very, very strange. I'm going to be talking about frequencies today, and using the term frequencies and resonance and all that very, very, very loosely together. I'm trying to keep it as unscientific as possible. Everything in life boils down to vibrations or frequencies. Your brain, and I think you people have attended a lecture by Jan van Brummelen. For instance, your brain is the whole time monitoring with impulses and that what's going on in your brain, coming back, giving messages, and nowadays we can measure those things and actually demonstrate it without even the patient having to touch that machine. There's other machines here that measure by resonance the frequencies, they get feedback, and that machine will very often diagnose where the stresses and that lie. Just to give you an example of how your brain and your subconscious works, and it's monitoring things all the time, and you can, by using what they call busking, in other words pendulum therapy, or muscle testing, you can get answers from your subconscious about what's going on in your life. So medicine is very much based on Newton's laws. Now Newton is that old bugger with the long hair who was sitting under an apple tree, and the apple fell on his head, and he said, voila, now we know about the cause and effect. And he postulated the three laws, Newton laws of physics. And our medicine and dentistry is very much based on cause and effect. We can treat the cause, for instance, and the sickness is then prevented. For instance, the measles vaccine. You're fighting the cause and you're preventing measles. But most medicine, if you think about it, most conventional medicine is interventive. In other words, we're treating the effect. The little bugger has been eating too many sweets, the whole thing, and his tooth rots. We fill it, rightly or wrongly, with amalgam, but we are actually treating the effect. Somebody develops an abscess, we drain it, give antibiotics, we're treating the effect. We are not treating the cause so much. In other words, giving an antacid for our stomach ulcers. About 10 years ago, it was discovered that stomach ulcers are caused by Helicobacter. So now we can use, for instance, Rife frequencies, kill the Helicobacter and prevent and treat the ulcer. Medicine and dentistry changes so slowly. We're scared of the medical and dental council. We're scared of our colleagues. We're scared of change. We've been using amalgams, for instance, for 140 years. Okay? It's poisoning us. And what happened 120, 140 years ago? Semmelweis started washing his hands and preventing puerperal fever. And we're still placing amalgam in teeth based on 140 years ago's technology. But we are slowly moving into the direction of Einsteinian or quantum medicine. E is gelyk aan mc kwadraat. And by changing any of those constants in that formula, we can do a lot of things. A very good book to get, really fantastic book, is called Vibrational Medicine. It's written by Richard Gerber. Now you see, now I go to exclusive books and I pick this thing up, and if I see it's written by a homeopath or whatever, I'm very snobbish and think, nonsense. But I read on the back, this man is a physician. Suddenly I pay attention. Again, we're limited by our snobism as well. This man explains quantum medicine, Einsteinian medicine beautifully. Read it. It's fantastic. But quantum medicine, Einsteinian medicine, resonance therapy is all based on using electromagnetic frequencies and harmonics. If we cannot, for instance, reach the frequency that we need, we go an octave lower or an octave higher, octave lower, and we use the harmonics to do the treatment. So we use frequencies and harmonics to destroy pathogens, but also to restore our sick cells to normal. Okay? Depression is an abnormality, for whatever reason, of our brain waves. For instance, the Rife gives you the normal brain wave and gives it in long enough, gets resonance, and you can restore your brain wave and slowly treat depression. Okay? Give us another one. Oh, that's fantastic. So frequencies and that, everything is electromagnetic waves. Okay? The colors we see, for instance, are part of the visible electromagnetic spectrum. In other words, this man has got a green jacket on. That green is giving off a vibration which my retina is picking up, turning into information, and I'm interpreting those vibrations according to my perceptions as green or as blue or whatever. Right. So broadly stated, if we can change the electromagnetic frequencies, we can heal sickness and even prevent it. Science, biology, is now scratching at the surface of how exactly at nano size level our cells function. And I've got a video here of a man, Paul Lipton, PhD, he's not a stupid guy, who says, and he can prove it, that our health and the way we behave and everything is dictated by our perception. And our perception comes from the outside, what we see, what we smell, what we hear, and then of course what we think. So by the lens through which we see our lives actually changes our genetics. It's amazing. And here we are as maxillofacial surgeons or as dentists or as doctors, en ons ploeter nog voort. And medicine and dentistry is slowly moving into it. Science is now moving into that interface between science and spirituality. It's fantastic. And I'm sorry I was born 20 years too late. In the next 20 years, we're in for amazing things, if we can only open our bloody minds. And eyes. And our souls. We must actually change the lens of how we look at life. If you think about Professor Imura, has anybody heard about Professor Imura and water? All right. He's taken with very, very fancy photography pictures of water at the point of forming ice. In other words, forming a crystal. And he takes, for instance, city water, which is polluted. It's full of fluoride, it's full of whatever. And he takes a photograph of it, and he gets a photograph of this crystal, and it's all distorted and malformed. Then you take water from a pure mountain stream, and it's pure stuff, all right? Now I'm getting to the lens. He can then take that pure water, which gives a pure crystal form, and he can speak to that water. Well, anybody can speak to that water. And you say to that water, you're dirty, you're this, you're that. Or play, jingling-a-ling, this underground rock music to it. And then takes a photo, and that pure water is all distorted. Because we feed it subtle vibrations.
The water is a living thing.
The water is a living thing. In other words, if you are a bag of water and salts, you can change a lot of yourself by talking to your water, by adopting an attitude of gratitude. You can change the water, your water. It's amazing. We're learning so much more about the cell and all these energies. And we're learning about the deep mysteries of life. We're getting to this place where science and God coexist. Many years ago we thought, yeah, the religious oaks are out there and the scientific oaks are out there. We're coming together. Now, Rife Resonance therapy is just one of the beginnings of this new Newtonian approach. And it's a crude one. It was invented by Royal Rife in about 1923. But let me just introduce you to the Rife Resonator. So, truth goes through 3 stages. First, it's ridiculed. You want to wash your hands before you deliver this baby? Ach jong, jy's mal. Then it's violently opposed. They, in fact, got Semmelweis so frustrated that he took a scalpel from an operation scene and he plunged it into himself, and he bloody almost committed suicide. He got very, very sick. Okay, violently opposed, and then finally it's accepted as self-evidence. Oh, yes, like, yeah, we've known all along that amalgam fillings are with mercury is poison. You know that. You know, we 40 years ago we didn't believe it, but now we do. It's self-evident. You know, this poor Royal Rife, if you read about him in the internet, was a brilliant guy. He was a trained ophthalmologist. He was a histologist. Fantastic self-deprecating man, and they hounded him, and eventually in 1972 he died in a haze of alcohol and Valium. And one can read that book, but it's also now new information is on the internet if you just look up Rife. Our paradigms are all based on what we've seen and what we've heard and what we've read. That forms our fact system. In the old days, people knew that the earth was flat. I mean, it looks bloody flat, especially if you're in the Free State. They knew the sun revolves around the earth. But old Galileo came along. Let's have the next slide. Galileo came along and he said, no. We revolve around the sun. Kom boetie, this is the Catholic Church now. Stand here and tie you up. We burn you at the stake. So, academics scoffed at William Harvey. He said the veins have got valves in them. Semmelweis, you don't have to wash your hands before delivering a baby. And as soon as he did, the woman survived childbirth much easier.